What's up, guys? Dr. Joe here from IDPT, and today we have another great episode. We're going to do a deep dive into a very popular topic. So what I want to address is, how do I avoid arthritis? And I think the best way to answer that question is to first understand and educate on what arthritis even is. Because if we know what it is, then we can attack it, all right? So this is going to be a really good episode. Stay tuned. All right, so to address arthritis or to avoid arthritis, the first thing we need to know, like I said, is what is it? So to learn that, we're going to need to do a little Latin learning. So the word arthritis is literally broken into two words. It's arth and itis. So the word arthritis literally just means joint arthritis. It's not a terminal sentence. It's not a death sentence like most doctors make it out to be. It literally just means you have arthritis in your joint. Now, the problem with it, or why people take it as a death sentence, is because really they're not given any answers. So they just are diagnosed with this thing. They've been having pain for some time, and now it's like, wow, what am I going to do? I'm just going to live with this forever. Then it's going to progressively get worse. Guys, that's not true at all. It's true if you let it be true and you let that be your narrative. But ultimately, this can absolutely be addressed. And it's something that if you don't have it yet, we want to get on this stuff early, because what we can do is actually avoid it or really prolong the occurrence of it. So again, arthritis is inflammation in the joint. So what I want to do is address, well, why do you have the inflammation in your joint in the first place, okay? So if we look at a joint, so right here is the knee joint. Every joint is encapsulated by fluid, and this fluid is what actually lubricates the joint and keeps it healthy. It's flowing with blood, different nutrients, vitamins, you name it, blood cells, right? So when I fully bend the knee all the way, we're going to squeeze the back of the knee and push the fluid to the front of the knee. And when I fully straighten the knee, the opposite is going to happen. The fluid is going to push to the back of the knee. Well, if that fluid is what keeps the joint lubricated and keeps it healthy, then the way that we start getting arthritis is when we don't get fluid to a certain part of the joint, okay? So the root cause of arthritis is having a limitation in joint range of motion, and here's why. Let's say we're restricted in the ability of the knee to bend, and we can only bend it right here. Well, then you can see that we're not going to get full fluid to the front of the knee because we can't fully go this way. And so if we have that and let that compound for years and years and years of not getting fluid to a certain part of the joint, what's going to happen is that these two bones, let's say in the knee, the bottom of the femur or the thigh bone and the top of the tibia or the shin bone, are going to start getting closer and closer and closer to each other until eventually you get the bone-on-bone arthritis, which is really like the end stage of arthritis. Now, how does the fluid actually prevent the two bones from touching each other? So at the end of the two bones that I just mentioned, the end of the femur and the end of the tibia, there's cartilage surrounding them. That cartilage actually has a charge to it, like a battery. Inside of the fluid, there's also a charge to it, because it's not just water, it's not just blood, there's all other nutrients and cells and substances in there that give it a charge. Well, when that fluid is in the joint, such as the knee, it repels the two bones away from each other, okay? But when we lose that fluid over time because we don't have full range of motion, what's going to happen is those bones can start inching closer and closer to each other until a point that they can physically start to rub on each other. Now, when that happens and they're actually rubbing on each other and you have bone-on-bone arthritis, for a joint purposes, yeah, that kind of is end stage, and we want to obviously avoid that as much as possible, because that is something that's pretty much irreversible at that point, which is why we named this video like, how do we avoid it? And the answer is get full range of motion back. But of course, guys, if you follow IDPT, you follow me along, you know that stretching is not going to get you full joint range of motion back. The only way to get full range of motion back is twofold. First, we need to make sure that the foundation of our body is established. So we need a pelvis and a rib cage to be in good alignment, to be stacked over the top of each other. Why that matters so much, like I've talked about in the past, is that the pelvis is the foundation that the back sits on, the spine, but it's also the foundation of the hips and everything that goes below it. And vice versa, the rib cage is the foundation of the shoulder blade and the shoulder, and it's also where the neck or the cervical spine sits on as the foundation as well. So first and foremost, we need to make sure that these are positioned correctly so that everything else we do outside of the pelvis and the rib cage are actually making long-term changes to what we need. Second off, the next best way after establishing the rib cage and the pelvis is to use what we call isometrics, to use muscles to mobilize joints. So for example, if we have a knee that is stuck and can't fully bend, we need to use a hamstring isometric in a bent knee position to quite literally pull on that shin bone and get us more range of motion back. So over time, we're going to start with easy low-level isometrics, just like, having a bent knee, turning the hamstring on and holding that. And then we're going to slowly start to progress those things. So we'll start actually using it instead of isometric, using it like a hamstring curl, for example, to start to really mobilize that knee. I keep using the knee as an example, but it's really any joint that this applies to. So overall, guys, arthritis is not a death sentence. All it means is that you have inflammation in the joint because you're not getting full fluid through that joint because you don't have full range of motion. So if we restore range of motion, we allow that fluid to circulate back into the joint, which keeps nice, healthy cartilage in your joints and ultimately prevents arthritis in the long term. So next time your doctor tells you that you need to go on life support for arthritis, you tell them, I watched IDPT's video and I'm going to be back in no time. So guys, if you found this helpful, please like, share, and subscribe. Share this to anyone that you think this would be of value to. And as always, see you at the next episode.